Hey everyone, welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe, a family doctor in Toronto.
And I'm Dr. Shazma Mathani, an ER doctor in Edmonton.
So this week we're covering the Pitt episodes 8 and 9, 2 p.m. and 3 p.m. in the shift. And oof, Shaz, this 2 hours was very, very emotionally like a roller coaster. It showed the toll of emergency medicine, the aftermath of pediatric loss, caregiver burnout, moral distress, and that constant tension between doing your best for patients while barely holding it together for yourself.
Yeah, these two are heavy. I actually thought that it might be easier watching it the second time because we've both already watched this entire season. Spoiler alert, it was not. No. But this episode really shows very accurate portrayals in terms of how teams work together, moving from devastation straight back into the next case. And this episode in particular, this episode of the podcast, we have a special guest. So make sure to stay tuned. Yeah. Make sure to stay tuned until the end of the episode because we have a very special guest joining us to discuss a case. So we're going to be joined by Fiona Dourif, who is the actor that plays Dr. McKay on the show. So make sure to listen to the end for her.
She's one of our favorites on the show. She's a total badass. And I'm so excited that she's here to join us to share about the a little backstory as to her role. And Shaz, I'm so thrilled.
Oh, me too. Can't wait.
Okay, so first off, let's start with episode 8. So it's the 2 p.m. to 3 p.m. hour of the shift. And the next case that we saw was around Mohan. And I thought this was really in a moment for her to shine. And this is when the influencer who came in and eventually we figure out that it's actually that she's been poisoned by mercury from the cosmetic products.
So we kind of like hinted at this in our first couple of episodes when we were talking about Mohan, but we've been like, been waiting for this. Like finally she gets her shining moment. She has been, taking a little bit longer and trusting her gut instead of dismissing it as psych. And this is exactly where it shines and where she gets to have that winning moment that we've been waiting for.
Yeah, she's always been called slow-mo and that she takes too long to talk to patients. And this was really wonderful. I agree. So next up, we get that pacemaker case with the slow heart rate and the low blood pressure. Shaz, I bet you see this a lot in the Emerge.
I do. And I actually like the thing that I love the most about that scene is that it showed the real-time teaching. So we saw Langdon kind of explaining the ECG findings. We saw Robbie kind of prompting him to think through the plan and the next steps. And then Javadi also doing some bedside learning as well with Langdon. It was really cool to see that dynamic between kind of attending, senior learner, and junior learner and how that dynamic was happening.
And so I remember this when I was a med student in the Emerge where we did the transvenous pacing. Is that not common anymore?
So it's actually not that common anymore. And so these days we actually use medications like dobutamine, which is a medication that can speed up the heart instead. And so transvenous pacer would only be used if that medication doesn't work. And that medication is now very much the first line thing that we try. But I have done one transvenous pacer before. They are quite rare, but this was a very accurate portrayal technically of how that procedure is done. And I liked how in that little interaction between Mohan and Langdon as well, he's kind of like reminding her to go and like write a note or write a procedure note for a patient. And then in the moment, it's like we got this cute little stat of the average emergency doctor gets pulled from task A to task B every 3 to 5 minutes. I can tell you, Sheila, I worked a shift last night. I had a medical student with me and it was like one of the busiest shifts I've had in a while. It was on a Monday, which are historically and classically the busiest shifts. Like we do see our numbers go up on Mondays after the weekend. And it was just absolutely chaotic. There were so many sick patients. I was getting pulled from one person to the other. My cognitive load was really high. And like every time I tried to sit down at my computer and like talk to my med student about a case to review with her, or even just like run my list to kind of decide like who can I discharge? Who can I do a consult on? I kept getting like people come up to me, like nurses come up to me with legitimate concerns. Like it's not that they shouldn't have come up to me because there were like other things happening where I was getting like pulled in so many directions. And I kind of at one point turned to her, and she's someone who wants to do Emerge and so has watched the Pitt. And I kind of turned to her. I'm like, yeah, exactly. Like this is, I'm sure you've already seen this episode, but Emerge docs get interrupted all the time.
Yes. I don't know how you manage to do that because it's like chaos. I just think of the chaos that exists. That's amazing. So true, right?
Yeah.
Our next case was one of the most devastating, I think, so far in the season, when it came to the situation where there was a case of a 6-year-old who was found at the bottom of a pool in a drowning case.
So this one, this scene even like I was saying at the beginning of the episode, I've already seen it. I know exactly what happens. I know what the outcome is going to be, but this scene absolutely wrecked me. Like that, I don't know if you noticed this, but like the room was actually quite quiet while things were happening. And so you could see the teamwork that was happening in there. You could see, you know, the grandmother coming initially and then the parents come. And that is often exactly what these rooms feel like, because they're, you know, I've mentioned this before. It's like the conducting of an orchestra, a team that works really well together. They just kind of trust each other and they know kind of what needs to be done in these very critical and life-threatening situations. And you could see that play out on the TV screen.
And I think as a backstory to the scene too, they often in the pit, they don't add music to these scenes on purpose. Like a lot of medical dramas have music to heighten the emotions, but actually that silence is purposeful to like hear the sounds of the machines, hear the movement of people's feet running around a room or moving carefully. And that's very purposeful to be very accurate to what you're saying. Like, so there emotionally, it felt very accurate. Shaz, was the case medically accurate as well?
Yeah, absolutely. I would say so. So in cold water drownings, we often follow the rule. Might sound kind of crass, but they're not dead until they're warm and dead. So that is like a very classic teaching. And you see that play out in that resuscitation where there are multiple comments on this patient's temperature and how she's cold, and they start actively warming her very aggressively, because in severe hypothermia, so cold temperature can actually protect the brain. There are lots of cases of where somebody has had a cardiac arrest either from a drowning or being found outside in a snowbank. And as we slowly warm them, that's when the heart actually starts working again and they recover and actually have good outcomes. And so in these situations, we don't even think about stopping resuscitative efforts until they've been completely warmed, and we've continued resuscitative efforts while their body is warmed. And so the way that we do that is with things like heated IV fluids, the warming blankets that they kind of had on her chest that you saw, and sometimes even ECMO, which we've talked about in a previous episode too.
Can you tell us a little bit about the potassium of 12?
So that's something that I immediately, as soon as they looked at the paper and said the potassium is 12, I was like, okay, I know where this is going, because this is a marker of basically irreversible cell death. Like Dr. Robbie kind of said, this is something that you can't come back from, and the show absolutely got that correct.
So let's reflect on that for a moment, because I think for me, when Robbie said, you know, there's absolutely no chance of recovery, it was very clear. It was honest, it was final, and it was what I think really what families deserve to hear, is that clarity and not a sense of false hope, which contrasts a little bit with the opioid case, to be honest. That was interesting.
Yeah, it's interesting. It is interesting to see that contrast, because, you know, when we talked about that opioid case, it was like they were really doing a lot in that moment to kind of solidify brain death. And so please go back and listen to our discussion on that episode as well. But this one really struck me because he's able to strike this balance that we live every day of like being able to be clear and final without giving any false hope, but also being very compassionate in the tone and the way that he used that language. That really stuck out to me.
Yeah. Let's do another quick teaching corner here, because I think this case really impacts us. We're also moms and we work in healthcare, and we have both seen drowning accidents happen. And so pool safety is something that we hold very dear to each others and as parents, but also as healthcare providers. So drownings, especially in kids, are sadly common, and they're almost always preventable.
Yeah, exactly. I think the biggest misconception that I think media has certainly portrayed as well or perpetuated is that drowning is loud or dramatic, when it's often actually usually silent and quick, and often can happen in under a minute. And so making sure that, first of all, you recognize that you're not going to necessarily be alerted to a drowning that is happening. Knowing that, it's important to keep kids close by, even in shallow water, because it can happen again very silently and very quickly.
And it's very hard not to be multitasking at the same time as being next to a pool. But something really important to do is like put that phone away, lock it up, keep it somewhere safe. Don't multitask by a poolside if you're meant to be the one in charge of supervising. Eyes on the water. Like we always will rotate who's keeping eyes on the water to make sure like my partner's doing that or a friend is watching the kids. We always rotate and our phones are down.
Yep, absolutely. The other thing to keep in mind, so if it's a pool versus like another body of water, for pools, barriers matter. So locked gates, four-sided fencing, like so all the way around, like no openings, removing any toys from the pool, just so that, something doesn't fall in or there's no temptation for a child to try to get around or over that gate. And for adults, like you said, avoid distractions like a phone, but also avoid impairing things like alcohol or other substances when supervising your kids around water, or if you're in the water yourself as well.
Yeah, absolutely. And I think the key here is that prevention is everything. So like learning CPR, using life jackets near open water. Don't rely on floaties, especially in the open water settings. Floaties just may not be strong enough. And these are the things, prevention is key here for drowning prevention. So let's move on to episode 9, which is the 3 to 4 p.m. part of the shift. And it opens on the aftermath of the pool drowning situation. The trauma room is really messy from the code. The team is exhausted. And again, it's really quiet.
Yeah. And so you can, like that scene of like the service worker kind of cleaning up the mess left behind at the trauma room, like that is exactly how chaotic things look. There are things all over the floor because you're just like, you're not worried about putting something in a garbage at that point, right? You're just trying to get the supplies that you need in that moment. And so you can like that, like it is chaos that is left behind afterwards. And I think opening with that scene and just kind of like showing it at the forefront and then immediately switching to like Langdon calling his wife and asking her to put his son on the phone and then like listening to him sing a song, or Dr. King or Mel with the ocean sounds. You can hear them in her headphones as she's listening to that, both kind of like coping in the ways that they need to in that moment before digging right back into the shift.
Yeah, totally. And Robbie's line there when he says, they do a debrief, and when he says the kids you lose will linger. Very true. I know every single clinician that I work with and my learners, we carry those cases forever.
And then, of course, as he's, telling his story and talking about this, he gets interrupted before he can even finish his debrief, which is like such a real part of the ER because that's just how things go. There are always more patients coming in, and it's unlikely that we're going to get the time, or we don't get the time that we need to debrief or sit with our trauma and our feelings before we have to dive right into the next one.
The next case was very interesting to watch, especially post-pandemic. We get back to the waiting room. And I actually love the waiting room scenes because it's really interesting to see the dynamic happening in there between patients, between the staff. And in the waiting room scene, we have an anti-masking mom. And that was a really big scene too.
Yeah, I also really love the waiting room scenes because I think that every once in a while I have some friends who need to go to Emerge and are waiting in the waiting room, and they immediately text me being like, how do you do this? How can you like live in this chaos? Because like that is the most chaotic part of the emergency department. And like this show portrays that chaos and that noise and like all these people like dealing with different things and different health conditions so accurately. Like that chaos is very well done in this show. And you can see that in this case where, like you said, there's this anti-mask mom, and we've certainly all been there. And it's certainly something that comes up over and over again now in this post-COVID era where you're trying to give care to someone and they openly tell you that they don't believe in what you're doing. It's really exhausting, and it happens almost every shift.
Every day, every clinic too. The next case that we get into is the MDMA case. So this was interesting. So seizure, overheating, total chaos. Shaz, we see MDMA use is increasing. How often are you seeing this in the Emerge?
Very often. I think this is actually a good spot to do another teaching corner because they treat this in a very specific way. And so for our listeners, it's important to understand kind of, I think, why they're doing the things they're doing. So in contrast to when we had the pediatric drowning case where they were trying to warm her up, in these situations, because of the way that MDMA works, you can see that they're actively trying to aggressively cool this patient. And so MDMA actually increases serotonin, which is a hormone in our body, and that can actually lead to an increase in body temperature. And so these patients can become very, very warm. They can have temperatures of 42 degrees Celsius or kind of like well above 105 or 106 Fahrenheit or higher, and rapid cooling becomes very critical. And so they are literally immersing this patient in an ice water bath because that is the quickest way to cool them down effectively. It is uncomfortable to watch this person like just in a bin of ice, but it is absolutely what we do in the Emerge and can be life-saving in these patients.
Do you have like a tub like that?
Yeah. So no. So what we do in Emerge is we use it's not quite a body bag, like it's not what that is, but like those like those kind of plasticky like scooping things that have handles where you would like scoop a patient from one stretcher to another. Okay. You can like basically create like a little basin, and then we put ice and some water in that so it's contained to help cool a patient quickly.
Okay. Thank you. I was trying to picture that in my mind, what would actually happen. Because they had like an actual, like an ice bucket challenge kind of thing there. It was also a really great moment for Santos after going through like where she dropped the knife into Garcia's foot the previous episode. Like this was a big redemption moment for her, a very good case for her.
I love it because, like, I mean, there's been this flavor of her being too cocky and her being too forward. There have been like interactions that she's had an interaction with Colin. She's had interactions with Mohan as well that were not entirely positive. And this moment really stood out because it was like a very positive interaction with her and Mohan, where she saw this patient start seizing. One of the common causes of seizures in these patients is that their sodium gets critically low. And so she recognized that immediately, saw what needed to happen, acted fast, and truly saved this person's life.
Yeah, so interesting. And then she's like doing so well. It was like a hooray moment for her. And then this is when that relationship tension between her and Langdon comes in, and he rips into her for overstepping and going ahead without sort of clearing it with senior staff or residents. And so it was really interesting because Robbie really stepped in quickly here. And I appreciate that, where he says, like, where does it say that shaming, belittling, and insulting are effective teaching tools? And that was a very strong statement. He was like berating and belittling her, right? Like it was actually really uncomfortable to watch. And so when Robbie kind of swooped in and really like was firm with him, that one really hit hard for me. We've all seen moments in medicine where hierarchy becomes harmful. And I think this was a moment that illustrated that. Oh, 100%. I still remember when I was a medical student and berated by a staff surgeon when something went poorly overnight in a situation, and it still like haunts me still. And I think I always remember that, because when I'm teaching my residents and medical students, I want them to know we're all human. Things can happen. Please be honest with me if you don't know something. This is not like, shame is not a useful teaching tool.
All right, and now for the most exciting part of our show, we have Fiona Dourif joining us to talk about her experience on the Pitt. We are so excited to have you here today. I've been like waiting for this day for so long. I'm like, oh, we get to talk to her. This is going to be so great. So we are so appreciative of you being here and joining us on the show.
Oh, I'm so grateful to be here. Also, to be able to talk to the people who actually do the work that I'm pretending to do is quite, it's a joy for me. So,
I mean, you're in the middle right now of filming for season 2. And so thank you for taking this time out of your very packed schedule to speak to us. You have a very big fan base in Canada, and we're just so thrilled that you are joining us here to chat about things. And Shaz and I always talk about how you are one of our favorite characters, because you really do deal with some of the more challenging, socially challenging topics that you're seeing in the Emerge, like the trafficking case that we see in these episodes, but also like the unstably housed family, the trans patient that you really beautifully navigated care with, David, who is threatening violence against women, and those like really hard cases that sometimes we don't realize that we deal with in medicine sometimes. So like, there's an intensity to how you advocate for your patients. How do you like tap into that energy as an actor?
I think what they were trying to do with McKay was to present a doctor who had kind of a full life experience before she came into medicine. So I came into it late and have had these experiences like with addiction, with jail, with like just complicated sort of extreme experiences. And to have that person being, 44, which is my age and my actual age, to be able to sort of relate to people where they're at from some kind of fuller life experience I think is my role on the show. And, they cast it sort of close to the bone. I am absolutely not an emergency doctor. I applaud you guys for the amount of like work and dedication it it takes to do what you guys do and to get there. But I have had sort of extreme experiences happen in my own personal life, and I think that that there's just something about my quality, some ineffable thing where that was portrayed in the audition, and I believe that's why I was picked for it. So all I can do on the show and all I try to do is relate to these experiences in a very personal way and try to speak the truth and help. And yeah, that's what I do over and over again. Try to be honest. Yeah.
Yeah. And that like really comes across in how you portray Dr. McKay, because, as you said, like it's clear from, I mean, like having gone through medicine, there are people that are at different stages in their life that decide to enter medicine at different points. Like there's, like the large majority of people that do the typical path, which I did, right? Of like, you finish your undergrad, you go to med school pretty much right after, then you do residency right after, and you carry on with your life. And life kind of happens in parallel to as you're going through your career. But there are like a handful of people like you're portraying with Dr. McKay's character that have a life before medicine and then decide later that this is their passion and their calling. And it's very interesting because in real life, in the real world, I can see that there is this whole wealth of experience that they bring with them in the way that they practice medicine. And you do an excellent job of portraying that as Dr. McKay as well, because you can see like there's like little, like nuggets of like the life experience that she has with, like with the ankle monitor that she's wearing, that there's some sort of backstory there that we learn along the course of the season. There was a moment where you allude to that you have like that character has struggled with addiction before. And so like there are these little, Easter eggs that are dropped along the way to help us have a better understanding of Dr. McKay's character. Are there any moments that kind of have stuck with you, that stayed with you after filming, kind of in her character arc?
I mean, I would say the trafficking case was pretty impactful. I also think the show does a really good job of presenting difficult cases in a kind of complicated, less clear kind of good guy, bad guy way. So an example would be the trafficker had this softness to her, right? Like, and that she was pregnant was a wild choice, right? And the girl was the victim was both a deer in headlights and had a hard edge, right? Like the casting won an Emmy, I think, for a reason, right? They were trying to present a full, complicated story, not straw man versions of it. And yeah, I mean, I have immediate family that fell into prostitution. It's something that I have a real relationship with, and it's complicated to get them out, and it's not easy, and there's a lot of like self-worth problems, and I just hope to do that story justice. And in the little sliver that we had with it, I would also say that the homeless mother was another one that was hard. I also, again, have immediate family that was, my mother, in fact, was homeless for periods of time in her life, and to honestly, to be thrown into that storyline like again and again just felt to me while I was filming it, I was like, is this like some kind of like weird message, not message, because I don't sort of believe in that, but just felt like some kind of wild coincidence that maybe I could do it justice, and I tried my best.
I think you really portray.
Yeah, you did.
Yeah, because I was gonna say, like, I mean, for me, and I know Sheila, I'm sure you experience this as well, but like, there are moments in medicine where you just want to do the right thing and like just hope that the patient will get there with you, but they don't always, and often they don't, and like that frustration, is really challenging to sit with and to manage. And I think that you really you portrayed that so well with Dr. McKay's character, because there wasn't just one case, there are multiple cases where you really try to connect with the patient to reach to make a difference, but they also have to be ready to meet you where you're at too. And so you really portray that frustration of, didn't really get all the way where you wanted to, but there are like little small wins that happen along the way, like with the trafficking case where she took the pen,
the pen's
with her,
gone.
right?
She took the pen.
I think that the show and that you as an actor really portrayed those like small wins in an important way, because those are sometimes all we get in medicine are the little things. And
do you have that experience from your own
every day
own time of
absolutely.
Yeah,
and also what you said around like when you are seeing somebody. And like when I'm seeing someone in practice who may have something very parallel to my own life or to a loved one who has gone through it, like you shared with us just now, those hit home in such a different way that I always have to step out for a moment and sort of rebalance in that way. And certainly in the emergency room, Shaz, like I don't think you have the same opportunities to take those moments sometimes, but I'm in family practice. But I recognize that. I'm like, oh, this is stirring up something for myself. And I think it really highlights like how human we are. We all, like, humans are messy and there's layers. And sometimes, like you said, like with the trafficking situation, we sort of have a picture of what a trafficker would look like. And we have these biases in our mind that we have to always manage in medicine of like a patient comes in and are they someone who may have had a history of addictions, and then they get labeled automatically. But we have to like step back and really take away some of that bias to do our jobs really well. And that's sort of the art of medicine. And Chaz and I both are teachers to our residents and medical students. And so that's always the messaging that we try to teach them as much as possible as well. But you do it so beautifully. Like I get tearful actually watching you on screen because it is a very real portrayal, and you sharing just now why it's so real for you just helps me understand. It's real. It's really your life too. Yeah. And so like, thank you. And I know many of us are impacted by the work that you do. And we mentioned it off camera before, but has playing a doctor changed how you see doctors in real life or how you approach your own healthcare?
Oh, goodness, yes. I mean, I think in a way, before you really spend time thinking about the field, you're just like, oh, you're an authority in a white coat, and at least in America, there's very little time with them. So you sort of you see them as like a tool to get what you need. And I don't think I had a lot of like thought around how many forces are working against being able to give you the amount of time that people want to give you. Like just the insurance and the paperwork and the deadlines and I mean, this experience has been illuminating. I am surrounded by real life doctors on the show. You can like throw a penny on the pit and hit a medical professional. That I think is one of the reasons why the show really works. And so I have a lot more sympathy for your guys' job and how hard you work. And and the impetus to go into that work just to help, I'm appreciative.
I think that one of the things that stands out to me about the Pit, I mean, like as a doctor myself, I've watched a lot of medical shows, like from med school onwards, the Grey's Anatomy, The House, Scrubs,
ER
all the
was
things,
our original.
right? ER.
Noah Wiley sorry, I'm not going to go there, but like, let me just, like, that was our.
Yeah, absolutely. But the only show that I ever found accurate before the Pit was Scrubs. Like it was actually pretty good at portraying what medicine was like. And was consistently rated like the most accurate medical show. And now the Pitt just blows it out of the water. And I think, Sheila and I have talked about this before, and Fiona, just kind of like you alluded to, there is this this perception, this public perception of what medicine is like, what doctors are like, what nurses are like, and what the system is like. And I actually don't think that media does it any justice, because it only just perpetuates this expectation, or this false expectation or perception of what medicine is like. And the Pitt does a really good job of actually like unveiling the mask of behind medicine, and like you said, like what the constant barriers and challenges that we are up against to try to just do the right thing for our patients. And I just love how well the show does at unmasking that and just showing as many people as possible what it's really like to be in this type of a system, and that we really are just trying to do the best thing for our patients. So thank you also for doing that.
I mean, I think one of the benefits of the show is it's sort of like it unglamorized it, right? Like I think casting was really careful to choose people that are, I mean, I think all of us actually are playing things maybe quite close to the bone, maybe Mel King aside, but
oh my gosh, Mel King.
Good.
Yeah. But I think they tried to cast sort of real people, and we're not playing sex, we're not playing glamour. It's about sort of the patients in front of it and the like consistent stress. And I think, I mean, I can just speak for myself, but in America, our healthcare system is so fraught. Like it can just bankrupt somebody, and then you're on the phone for insurance and nothing gets paid for. And it's hard not to vilify this system. And I think that, this experience for me, at least, like detangled the system of payment from the people who are actually trying to provide care, because I think it can get meshed. And I also like that I don't think we're presented as heroes. I think that they try to present like full humans who are struggling with their own mental health and their own issues that bring bias. And it's just trying to present the full picture. And then it's like, okay, if you have this full picture, what do you think? Like, do you do you have empathy for that? And just the success of the show was a wild ride for me. It feels like I've been on this crest of this wave. It almost doesn't feel real. But I've had, more than anything else, healthcare professionals approach me in public. And that is like, I would say 80% of the people who talk to me. And it's just this like gratitude that they're expressing. And I'm like, don't express it to me. I just want a raffle and I get to be here. Yeah, it's the concept of the show, which was, I think, at first presented by Noah Wiley, and then with Scott Gemmell and John Wells, they just kind of got together and said, let's do this. And it ended up working. Yeah, it ended up working. John Wells said to me, you could make the same thing over and over with all the right elements, and once in a while you hit lightning in a bottle, and you don't know why lightning hit there and not there. But, I think this, certainly for this year, I don't mean to speak for him, but it's my guess that he thinks that this is the lightning in the bottle.
You guys really keep it real though, right? I mean, that's, I think, like you said, like the when you describe just the baggage, really, I'll call it what it is, the baggage that we bring in with us to work. And like, we're supposed to leave it at the door, but you just don't, right? That's what actually makes you a better provider, to like the life experience that you have. And you portray that well, like we've talked about with Dr. McKay, like the life experience that you have actually is helpful. We see that with Santos as well, right? There are periods where she clearly has this life experience that she's bringing with her that's actually making her patient care better. There's one thing actually. So Sheila and I have talked about this before on the show. We read somewhere that you, as all the actors, had to actually like practice the medical skills, like on dummies and stuff. And so, can you tell us a little bit more about that? Because that was really interesting to read about and learn about.
I know everybody wants to know about this. So when we for season 1, we were called in 2 weeks before we started filming for boot camp, they called it. And we were brought into Warner Brothers to like a studio lot. And there was 3 real practicing emergency doctors. And we watched, and they just gave us like this primer. I mean, it was about 8 hours a day for 2 weeks on what it actually means to intubate, what we're doing, what it means to suture, and just like a real basic primer of systems of the body. We watched absurd medical videos that I was like, I don't know if I'm going to be able to stomach this. And I just made myself, it's like, Fiona, you are here for a job. It is your job to make yourself watch the surgery. We watched a lot of actual surgeries, and then dummies were brought in where we learned what CPR actually is, what intubation actually is. And then volunteers were brought in so that we could do actual medical physical exams. So we sort of just like had a basic actual understanding of what we were doing before we went in, because when we actually shoot the Pitt, it's shot in real time. So there's a hospital that's built between 2 stages on Warner Brothers that has no breakaway walls, which is very uncommon. And it has a ceiling, which is uncommon. Every drawer is filled with actual medical supplies. You walk in and you feel like you are in a hospital. There's no facade anywhere. And there's 150 background artists moving at the same time that you're shooting everything. And so it feels more like a play than a regular television show, where you can't be like, oh, and I need to take that again. You just have to keep going. So there's those trauma scenes happen so fast.
Yeah.
And we do each angle a couple times, but you really have to, it feels like you're performing a play as opposed to a television show. Just because the reset is so intense each time. You can't stop. And then, so the boot camp was really interesting. We also did a week-long boot camp before shooting season 2. We also introduced new characters, so they did the full 2 weeks. And then there's a lot of consultants and a lot of people there to ask the actual questions of like, what does this mean? What am I actually saying? How does this surgery actually work? Like, there's just a lot of attention paid to that. And I feel like we're vessels to tell that story, as opposed to like, what's my feeling? What am I like? It's more about the sort of the work of it, the patient, really, like.
That's awesome. It's like a bit of mini medical school almost, right? Like going through
I feel like I could intubate somebody, but nobody should ever let me do it.
Yeah.
Never let me do it.
Was there an actual procedure that was your favorite that you learned?
I mean, I'm going to go back to intubation just because during the mass casualty, I did it so many times, and there was so many background artists that had that thing in their mouth, over and over and over again. So testament to them. I found that the people who had military background were better sports. We had a lot of people who were like post-Navy and stuff, and they were, anyway.
So you're actually doing it to to live people?
Never. Never, of course, with the full,
right, just partially.
There's they call them shorties, but you do have to like get the angle right, or it doesn't look real, right?
Right. Shaz has noted that. She's
I'm
their precision
I'm processing
is so
this.
right.
So like the laryngoscope is what you're talking about, like the thing that you put in to look. And so I'm like, oh, interesting. Because like the angles and everything are accurate when you're doing those. And I'm
good.
No, they are. And I'm like, yeah, but those are real people. And then I think to me, it's very obvious when it's shown on the screen that it's a dummy like that is very obvious to me, but, a realistic dummy, but still, but yeah, they show the external part first of you guys, like putting laryngoscope in. So yeah, of course that there would have to be people that would be accepting of having those put in their mouth.
That's amazing.
Yeah, totally. How many times during a week working or a shift would you do an actual intubation? Is it
very often? So I work in an inner city emerge in Edmonton, and so we are have the highest volumes in Western Canada, and have like multiple shelters within a 3-block radius of us. So we are a very high volume trauma center that sees a lot of inner city medicine, lots of addictions, lots of trauma, and so it is at least like multiple times a week. If I'm working, I would be intubating someone. It's like probably one of the most common invasive procedures that I do with an ER doctor.
Can I ask you what the most common case you have is? What you see the most of?
Yeah. Aside from like the usual abdominal pains and chest pains, because those are pretty common, the most common serious case that I have would be a drug poisoning, like an opioid overdose, typically, because of where we are situated and because of the current crisis that we have. That is, again, multiple times a shift, typically.
Yeah. And you Narcan and
yes.
Narcan and Observe.
That was the other one that you were, that just reminded me. The other one was like because you were the one in the vehicle that was like the first one there that asked for the intranasal naloxone. Yeah, so we do. Yeah. So we don't use as much, like there is intranasal Narcan that the general public, like lay people, would have with them. But we also have Narcan kits where it's intramuscular. So we just anyone can just stick a needle in an arm or a thigh and give Narcan. And as you know, and as you guys really did a good job of portraying on the show, it is a life-saving medication that immediately reverses the respiratory effects of opioid poisonings.
Yeah. I'll tell you a personal thing, which is like a little too heavy, but really kind of impacted my experience on the show is that is how my mother died. Is she died of a heroin overdose. And so I would, it's okay. I mean, I think it's prevalent, right? I'm like telling a story that is a lot of us, you know, and to like my experience of shooting those scenes and then seeing the girl, it felt like honestly, it felt like a gift, but it felt like pretty wild, you know. Yeah, I don't mean to have like a weird smile while I'm saying this, but no. But it was. I felt like, well, how nice it is that that I am I happen to be an actress and a person who has such a personal relationship to this stuff, and then it's like acting out and people like it. It feels like it feels like a gift or something, actually. I mean, it was 9 years ago at this point, so I've had time to,
Thank you for sharing that with us. It's like such a person. No, but it's just one of those things where I hear what you're saying, and that you acting through that, it also has helped a lot of people understand the importance of this medication and how important it is that the people that behind the numbers and the stats that we're seeing are human. And that is something like actually Shaz and I have done like mini teaching corners when we do the Pitt recaps, and Narcan was one of our teaching corners where we said everyone needs to know how to use Narcan. Everyone needs to have Narcan on them because we have an opioid crisis happening across Canada, the US. It is so important. And I'd say like one of the most beautiful things about the Pitt, like that case and other cases around organ donation and other pieces, is that you are changing the narrative around very difficult to talk about topics that we struggle with our own patients. But you make it easier for us to talk about it because we're seeing it in such a real, beautiful way that like I talk about the Pitt in my office, and I'm like, have you signed your organ donation card? Yeah, like these are things that or have you had that end of life discussion? Yeah. And my patients know that I'm a big fan of it, so they've started watching it too, and they're like, oh, I saw that episode, and let's talk about it. And I think that's this like effect of the show. It's super impactful, and I love that you shared about your mom, and that in a way sounds like it was almost therapeutic in a way to be able to act out that scene, if that's
act
fair
it
for me to
out.
say.
Yeah, act it out,
Yeah.
and like it's people that look like me. It's everybody.
100%.
That's just it.
Yeah. Yeah. I read an article recently that said that since the Pitt, I hope I can summarize this accurately, but it was since the Pitt that there has been an uptick in discussions on end of life. That was definitely one of them. Yeah, and I think that was one of the hardest storylines for me to watch, actually, when I watched the show. It's very hard for me to watch the show just for self-absorption. It's very hard for me to watch myself. I just only see what's wrong. But I think that's actually a general thing that happens with actors. Like, imagine watching your face do something. But
Yes.
but I do find myself getting lost in the show, which is a testament to how good it is, because that has never been the case for me and any other thing I've done. But the two older siblings having a discussion on their father's death and what to do and what he wants, I think is something that must happen all the time.
It's all the time. And in the worst possible moment for it to happen.
Yeah.
Yeah. And the conflict, right? Everybody thinks that they're doing what's best. I also love that about the show. Like we take very complicated social issues, I think, both in Canada and definitely in America. And I think they're pretty good at not presenting the straw man argument of the other side. And I just, maybe as a 44-year-old woman, I'm desperate for that conversation of like taking the steel man argument of like somebody who thinks differently, and then the like liberal argument, and then putting them together in like an I think that our news cycle never does that. So yeah,
totally.
And it's nice to see that richness as well of being able to have like a fulsome view of very topical but often challenging issues to have discussions about. I think the Pitt really threads the needle very well with that.
Yeah, and there is so much more to come in season 2. Oh my God.
Wait.
Is there anything that you can, I know you can't share anything with us about
can't
season
share
2,
anything.
but like you're excited about it. It sounds awesome, like from the teasers that we've seen.
Yeah, there's a lot more character. I think the main sort of like season arc of the show is character driven in a way that I think is unique to season 1, and there is another. We present something that is happening to hospitals now that I can't give away, but I think people maybe aren't that aware of. Can't give it away. That's all I can give you.
That's okay.
Is
No, we're excited to
I
watch.
know everyone's like just waiting.
We're just
all
waiting.
gonna watch.
Yeah.
Love it.
Is there
ahead,
a thing in the show that you felt like was unrepresented that you find that you deal with? I can pass it along.
Yeah, you guys did such a good job. Like every episode of this show that we've had before this of recapping is me being like, they did this so well, and they did this so well. The one thing I will say, and I know that Noah Wiley has talked about this, is that there were not respiratory therapists on the show. And I know there was a thing that said, I read an article saying that has been acknowledged and that there will be respiratory therapists in the second season. That one really stood out to me. Like it was within the first couple of episodes. I'm like, they're intubating someone. Where's the RT? So, and then there were RTs that kind of came a bit later in the season, but that one was glaring for me.
No, it's like the balance that you strike is great. Like the humor, like the scrub changes for Whitaker, those like quiet moments in between patients that you captured. Like it's not like we've been really overwhelmed at how wonderful the show is. And this is why we're like just so thrilled to talk to you out of your busy schedule to take this time. We love it. And we love you and all that you've done to represent us in such a beautiful, authentic way. We have a quick finish to what we usually do, if that's okay. We do a true or false round really quickly to end things. Nothing major, but we were wondering if we could do that with you.
Of course.
Is that okay? Okay, Shaz, do you want to go first?
Yes. Okay. So, Fiona, true or false, you can now confidently hold a scalpel.
True.
Yes.
Like a pencil.
It. Yes, that's exactly right. I love it.
Okay,
like a pencil.
So true, that's like a pencil. True or false? The fake blood stains everything. Or does fake blood stain everything?
True.
Yeah. There's so much blood in some of those scenes.
So much blood.
A lot.
So much blood.
Stains everything. Stains everything. Yeah. Yeah, definitely. Side note, during the mass casualty, all of that blood on the floor was a copyrighted new invention from developed by our production designer, Nina Ruscio, they were like these gel kind of like throwdowns.
I read
that were
about
different
that
colors.
somewhere.
Yeah. It was very cool.
It was very real. Okay.
Yes. It like even down to the color. The color is perfect, actually. I mean, like I know that's such a silly thing to say, but
yeah. There's a lot of thought, lot of like careful, smart people put in a lot of thought into the show.
As like another side note, like whoever is doing like the makeup and like that kind of stuff, like the special effects type things, like even like the wounds that are shown, like all of those things are so well done and so accurate. Like that was really cool for me to see as someone who sees those things every day at work, just like how accurately those different medical ailments were portrayed. It was great.
I mean, my partner had to walk out of the room when the degloving piece. He was like, "I can't. This is like, I gotta go." Like this, and I'm like, "That's what it looks like."
Wait till episode 1 of season 2. It's
okay.
I just watched it. And I was like, "Oh God."
And see, for me, like Sheila will run away, but I'm gonna be like, "Oh, this is so good." Like I'm the type of person that can talk about gross things at the dinner table because it doesn't faze me. But like.
I'm going to hold your hand and give you all that Kleenex because I hold my patient's hand all the time. That's my role. But like, the degloving stuff, I'm like, We are balanced. Shaz and I are balanced of what we do. We have 2 more quick true or false.
Oh, yes, please.
Another true or false. Yes. Okay. So this, I like this one. So true or false, Fiona, you would rather do a 12-hour hospital shift than a 12-hour filming day.
I mean, it's false. I think what you guys do is shockingly nonstop. We get to sit down between, and we get to go to lunch. We have like an hour lunch where we walk to this buffet, and I have a dressing room. I mean, I am awed by the amount that you guys work and the stress level. I mean, it's stressful to perform, but I think to actually have the person's life in your hands is a level of stress that I don't think that I could comprehend. So I think I have the easier job.
I'm glad that you mentioned the food thing because that is also really well portrayed in the show. Like when Dr. Robbie just has like a granola bar, he takes 2 bites out of it and then just puts it in his pocket because there's like just no time to eat it. That one's pretty accurate for sure.
We have steak. Yeah.
Love it.
Oh, well, that's very nice.
That's what I have when I get home after 12 hours.
When you get home.
After 12 hours. Yeah.
Amazing. Our last true or false, Fiona. So true or false, you've diagnosed your friends based on what you've learned playing Dr. McKay on the Pitt.
It's totally true.
Yeah.
I love it. Is there a story there that you can share?
Oh, I just have, I have ill-conceived opinions about, like stomach aches and fevers, which like I am just not equipped to actually give advice for. But, I'm like, oh, you should, not take ibuprofen here, but do take it there. I mean, I have to walk myself back from feeling like I actually know what I'm talking about, because I think you guys have gone through a lot of school. I went through 2 weeks of boot camp at Warner Brothers.
That's probably more than a lot of other people have gone through that are not in medicine, though. So I feel like there is like a certain level of street cred that you have there.
Yeah. Thank you. I mean, I do every operation or situation that I portray on the show, I like research, but I can't pretend to feel like I know what I'm talking about. There is this story that I have from ER. Noah Wiley was on it for 15 years. And he's extremely good at suturing on he actually feels like he's an expert, actually. He's just had
probably could be with the amount of like medical acting that he's done.
So the costume designer, Lynn Palo, during ER, she's also on our show, needed a stitch. And Dr. Joe Sachs, who was an executive producer on ER and is also the kind of head medical doctor on the show and is the reason why we're accurate. It's Dr. Joe Sachs. But he oversaw Noah, who actually sutured her in real life.
That is awesome.
Okay.
I love it.
That is awesome.
I love it. That's such
amazing.
a cool story.
Which is a wild story.
Also,
to be like Noah Wiley.
This
guy.
That's from that.
Yeah. That's from Noah Wiley.
Scar.
Yeah, exactly.
Yeah.
The guy on the building, he did that.
Yeah. That's amazing.
Yeah.
Fiona, this has been really wonderful to speak to you. Shaz and I have been looking forward to meeting you, and just a great deal of gratitude for all that you do and all of your castmates and the team behind the Pitt. Like, we cannot say enough how much of an impact you have on our lives as healthcare workers and the lives of our patients, and changes our conversations so much. And we're just super grateful that you took this time to speak to us. So thank you so much.
I'm so grateful. I'm grateful for what you guys do. Thank you so much. I had a great time.
Thank you.
Thank you. Thanks for being here. Yeah, this was a great conversation. That was so great. Thank you again to Fiona for joining us for this episode. It was so insightful to hear what she had to say about her experience acting on the Pitt.
So these 2 episodes really captured everything that we talk about on this show: the medicine, the humanity, and the cracks in between.
And, those last scenes, we didn't really get into them, but we will in the next episode. But just the drowning that we talked about, but then Dana's assault, which is going to build a lot more over the next few episodes. We felt that grief and the admiration kind of all together, with people continuing to show up for their patients.
So next time we're going to take a look at episodes 10 and 11. And if you've been watching ahead, it only gets heavier.
Thank you so much for listening today. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And of course, please be sure to follow us on social media at the Doc Talk Pod and send us your questions.